Let's talk about a common pigmentation disorder called melasma, also known as a pregnancy mask. This is a skin condition that causes dark brown, and sometimes a grayish patch that appears on the face, commonly appearing on the cheeks, the upper lip, the chin, the forehead, even the jawline. It can also occur in other parts of the body, like the neck, like the décolletage, and even the shoulders and the forearm. While we don't know the exact etiology of melasma, we do know that melasma is thought to occur mainly from malfunctioning melanocytes, the cells that help create pigment, causing them to produce too much melanin in certain spots. As a result, people with light brown skin, darker skin tones, may be more likely to develop melasma as they have more pigment and more melanocytes than lighter skinned individuals. Genetics also play a big part of melasma. We have studies that actually do show that people who have had another family member with melasma are at increased risk of suffering from melasma themselves. Unfortunately, women are more likely to get melasma than men. Only 10% of worldwide melasma patients are in men, whereas 90% are in women. And 50% of all women worldwide have some form of melasma occurring in their lifetime, myself included. After giving birth to my daughter, I too developed melasma around my forehead and along my cheeks. Other conditions include oral contraceptive pills and HRT, as well as heat. There's a vascular component to this. So how to treat melasma? I recommend the following. Number one, sun protection. Sun exposure can trigger melasma as well as other forms of hyperpigmentation. One of the most important daily steps is to protect your skin with a broad spectrum SPF, even on cloudy days, and often reapply them, particularly on sunny days. Number two, avoid triggers. If you have already had melasma, you tend to understand what your triggers are. And it's really important to try and avoid those triggers, such as sun and heat exposure. When the sun is at its peak, typically between 10 a.m. and 4 p.m., try and seek shade or wear a wide-brimmed hat, sunglasses for added protection. Also opt for lightweight, long-sleeve clothing, which seems difficult to do in the summer, but it's your best option to keep yourself protected and shielded. Melasma is also triggered by heat, so keeping the skin cool and avoiding direct sunlight is super important. Remember, prevention is key. Number three, gentle skincare. Avoid products that increase redness or inflammation, as this can also trigger melasma. Opt for gentle cleansers and non-abrasive exfoliants. Number four, hormonal changes. Definitely important to consult with a healthcare professional to address any hormonal imbalances or changes that may contribute to melasma. This can be anything from pregnancy to oral contraceptive pills to even HRT taken during menopause. Number five, topical treatments. Not many people know this, but after developing melasma, I wanted a way to treat my pigmentation effectively, and that's really why I created MZ Skin. It was to reduce the discoloration and promote collagen and elastin production for bright, beautiful skin. The research later became the foundation of MZ Skin, and the products that I've created using vitamin C, for instance, like MZ Skin Brighten and Perfect, helps to decrease not only pigmentation, but also helps to brighten skin. Look out for ingredients that contain azelaic acid, tranexamic acid, and peptides that can also help with discoloration. Prescription medications like topical hydroquinone, tretinoin, and corticosteroids can also be used in combination and prescribed by a doctor in order to help with pigmentation issues. Number six, peels and laser and light treatments. We have a large armoire of treatments that we can do in office, ranging from light peels, chemical peels, to light lasers, as well as light treatments. This includes BBL, Moxie, and Halo in combination with skincare. Remember, melasma is a very complex condition that waxes and wanes. It can be triggered and treated by a variety of mechanisms. What works for one person may not work for another. It's really essential to consult with a dermatologist or skincare professional to determine the best course of action for your specific needs, whether it's just topical skincare or a combination of in-office treatments as well as home treatments.